Hi, I'm really excited to announce the forthcoming 2-day workshop, Advanced ScarWork After Breast Cancer Surgery. This is a 2-day highly practical workshop for people who've already completed Sharon Wheeler's ScarWork qualification. Don't worry if you're feeling a little bit rusty on some of your skills or you did your original course a little while ago. We start off the day just recovering the information that you would have had on your original course. We'll go through some paired practice and we'll quickly be looking first of all to recap on your techniques and then really talking about how to adapt them and change them, which will be appropriate for common complications which are seen when people have had breast cancer surgery. What you're looking to do is to make contact, keep your hand rested, push down gently into the tissues until you hit a slight bit of resistance, then come back off. I've got loads of experience working with breast cancer. It's been an area of specialism I've been interested in since I first qualified. And what I'm going to do is bring my skills and knowledge into that workshop. We start off with some pre-course reading, just so you'll already become familiar with some of the topics we'll be discussing on the course. The workshop itself is a mixture of theory and practical on both days. We'll be making sure that you're aware of common complications and considerations and contraindications which will be relevant to your clients who've had breast cancer surgery. You need to be able to feel confident that you'll adapt your ScarWork treatment, which might not aggravate if somebody's at risk from lymphedema. We need to know about how to work with the techniques over the delicate area of the breast. When we're working over an implant, that means that you're not talking about integrating the scar tissue into the underlying tissue, because the underlying tissue isn't alien to the body itself. So what we're going to look at when we're working over an implant or an expander is actually trying to lift the tissue, trying to get it moving so that when the client finishes their session, they actually feel a little bit lighter, the breast is sitting more naturally and they feel more comfortable. We're then going to talk about, is the breast stuck underneath the implant or the expander onto the chest wall? Where people have had reconstruction surgery, we've got to think about how biodynamically that is going to impact on their movement. We've got to look at what adhesions are likely to have occurred after surgery. So we start off with some theory information, really getting you familiar with all these considerations. Then we're going to do some paired practice. We've got an afternoon client sessions where you'll normally work with 3 different women who come in with different presentations, from lumpectomy, mastectomy, reconstruction with their own tissue or with implant and expanders. Then on day 2, we're going to come back, we're going to really have another little recap just to make sure you're fully confident with the skills that we worked on day 1. We've got a chance to expand a little bit further on some of the theory, talking about perhaps if you've got clients approaching you who are still going through chemotherapy, safety and precautions, how to work with consultants and other medical practitioners to give a smooth service to try and expand your business. And make sure that you feel confident in being able to assess the client, being able to communicate how you think ScarWork techniques will help. And what we're going to look at is by the end of the course that you feel much more assured in your knowledge that when a scar feels a certain way, that you've already got some ideas coming to mind. With this kind of presentation of scar, I want to be pulling that technique out. I'm going to be looking to lift the tissue, to mobilise the tissue, to separate the tissues, to bring the tissues together. We're going to be talking about really working on these skills and developing your palpitation skills as well. We'll talk about how to do simple assessments with the clients. By the end of the 2 days, I'm sure you'll feel utterly exhausted, but I hope you're going to go away absolutely buzzing and waiting to bring in some new clients where you can confidently be reassured that you've got some techniques which are going to aid their recovery safely. Thank you very much.